Hola a todos. Hello, everybody. Voy a hablar en inglés, pero sí debería de haber subtítulos que pueden usar en español. I'm going to be speaking in English, but there should be subtitles in English and Spanish that you can use as well. So I hope you all had a good week, good day. I hope that the holidays were good for you. I hope you guys spent a lot of time with your family. So I was assigned to give a little bit of a talk for the youth. I decided I kind of wanted to do a little bit of a presentation, be different. Just kidding. But I did think that it would be a little bit more engaging. I hope that this type of format is helpful, and maybe I'll keep doing them in the future if I get called again to do something. But for the youth, I'm sure this is something that you're familiar with seeing a lot, especially with school. So I figured, hey, why not? And so usually when the youth is called to give a talk about Joseph Smith for this event, we give a history of his life from his birth up to about the first vision, I believe. And I noticed in the past that we typically just do a pretty general talk. We give a lot of information, a lot of dates, a lot of events that happened between the time. And I kind of just wanted to focus on one. So I got this idea from one of our youth meetings. I think Brother Shaveen brought it up, talking about his surgery, and that intrigued me. So I did a little bit of research. I read some articles. I watched a couple videos, and I also, I think there were a couple books that I kind of just read some quotes in from that were very insightful, and I'll be reading some of them in this presentation as well. So I'm just gonna kind of jump right into it. I think there's also, with the pandemic going on, I think this is a good kind of a thing to talk about, because there was also a pandemic going on during his time, but we'll get into that a little bit later. So Joseph Smith, he was born in 1805. Just a little bit of backstory for him. He was born in a small town called Sharon, Vermont, and they lived there for a short while. Let me get my pointer out. There we go. Or actually, I don't think that's the right one. Laser pointer. Here we go. Okay. So these are his parents, Lucy Mack and Joseph Smith Sr., a fine couple indeed. And they lived in Sharon, Vermont for a while, but after, I think it was, I forgot what it was, but Joseph Smith's dad needed to find new work. And so he found work as a laborer in 1813. Joseph Smith was about 7 years old. They had to move out to a town called Lebanon in New Hampshire. So this is Joseph Smith's family at the time. At least I hope it was. I'm not sure which one of these was Joseph Smith. Whichever one looks more like a 7-year-old. Maybe he was a tall guy. Maybe that's him. But he was one of these kids, and during this time, the typhoid epidemic was present. So the fever was running along, and every single one of these children got infected. So just a little bit of an introduction to what typhoid fever is. It's just a really simple breakdown. It's a gastrointestinal disease. It's caused by Salmonella typhi. It's a bacteria you really don't need to know about, just a bacteria. It infects your intestinal tract and also your bloodstream. So these are some of the symptoms you can kind of refer to if you ever get it, or hopefully you never get it. Or just to kind of get an idea of what these kids were going through and what other people at the time were going through. So you got your fever, which sucks. You got your headache and muscle aches. I had muscle aches before, not really good. Stomach pain, I think that's probably one of the worst ones for me. There's this noticeable rash that you could get in your upper abdomen and your chest, loss of appetite, of course, diarrhea, which leads to dehydration, exhaustion, and confusion. So just any combinations of the things makes for a bad day. And so I kind of wanted to put this slide up just for people to get a sense of the difference in the times. So in today's modern day, these are all common sense things, right? Let me get my pointer out, my pen out. So back in the day, you had, you'd boil still water when you're making a soup. You'll boil your tea, but you wouldn't really boil just casual drinking water. You'd grab it from your well, you would grab it from the stream, leave it in a bucket, and you just drink from it, really. But nowadays we have our water dispensaries and we have our water filters built in right into our sinks. It's no problem. And if their wells or their rivers get contaminated for any reason and they're watering their fruits or and vegetables and they're selling them, it can really spread. If they're not washing their hands, this is really the big one that we kind of want to talk about a little bit more. If you're not washing your hands, then it's a big problem. So think about the pandemic that we're in right now. When you shake a hand with anybody, whenever I shake hands with one of my siblings, not washing my hands. Just kidding. Well, sometimes, but most of the times, depends where they've been. If we're all exposed together, it doesn't make too much of a difference, but you can never be too safe. But you go to church, for say, and you shake someone's hand, you whip out the hand sanitizer and you disinfect. You go to work, you come back home, you're ready to eat, you disinfect. You go to the grocery store, you want to get some food, you come back, you wash your hands, you scrub well. Some people even change their clothes, but you get the idea. Back in the day, I'm sure they washed their hands. I'm sure they prepared for supper. They washed for dinner, or they took baths, of course. But washing your hand just for every little thing, no. Think about before the pandemic, the mentality that we probably all had, unless you were a germaphobe. You shake someone's hand at the dinner table when we do our gatherings for Thanksgiving and stuff, when we have our potlucks. Nobody really cared. And that's because you didn't have to care, because for the most part, nowadays, our hygiene is a lot better. But back in those days, you had the stables, you had the toilets, you had just touching everything and not washing your hands. And it's kind of the same mentality. It's normal. Didn't really matter too much. You just wash your hands if they're dirty, basically. So kind of just wanted to make that distinction. And so at the time, Joseph Smith's mom, she was about middle ages, 37. And if you can imagine it, I'm sure for all of the moms, suddenly you have a bunch of sick kids. And I didn't really know if she was sick. I didn't recall, but I did notice the amount of exhaustion that she must have been going through. So if you have a kid that's sick and sick with something like this, then you already know there's not a lot of sleep going on. There's constant complaining. I don't know if complaining is the right word, but from the children about the condition that they're in, the pain that they're feeling, and that can be over alarming, over stressful for somebody to be a caretaker at all times for somebody like this. So just a couple of facts about the typhoid fever and the mortality rate of it. In the pre-antibiotic era, so this is before antibiotics were made or discovered. And for typhoid fever, that's one of the ways that it is treated is with antibiotics. But before antibiotics were a thing, the mortality rate was about 9 to 13%. So this was the early 1800s. I'm not really sure what the rate was for that area. I couldn't really find any information about that. But even so, 9 to 13% essentially translates to about 1 in 10. So with the family that they had, it was extremely likely that one of her kids was going to die. And a couple almost did. Hiram and Sophronia and Joseph were all infected and had symptoms that were dangerous for them. His sister Sophonia, she was hit the hardest. She actually went into shock and she passed out from her fever, but she was able to recover. And luckily, Joseph Smith also was able to recover, as if we didn't already know. Unfortunately, there was a complication with his recovery. So after his infection with typhoid fever, he got this swelling in his arm, as if I don't know why I did that. And a doctor came to see him. His name was Dr. Parkers, I believe. I don't think it was Dr. Stone, Dr. Parkers, who opened it, and he drained a quart of pus from his abscess. So I don't know if you've ever had like a little pimple and you kind of pinch it and you just see like a bunch of that white stuff come out. Imagine it being super large on a 7-year-old who has a skinny arm. You know, he's not lifting. He has this big old thing on his arm that's not supposed to be there. And somebody just comes and they cut it, and an entire quart. I'm not really sure of a good way to describe that. I think it's a quarter of a gallon. That sounds about right. Might be a quarter of a liter. I'm not entirely sure. But all of that coming from a little boy must be alarming for everybody. But a little after that cut was made on his arm, he started to feel pain on his tibia, or the shin bone. So this bone right here. And nobody really knew why. And so they had another doctor, or the same doctor, I'm not too sure, examine him. And after the examination, it was determined that he had osteomyelitis. Now, what is osteomyelitis, you might say? Well, just a very brief and simple kind of explanation of what it is. It's basically just a bone infection. It can happen by an infection in the bloodstream that spreads from nearby tissue. So maybe you had an infection in your hand, for example, and it spreads to your bone. Or maybe you got an open wound and it opened up to your bone and you got a direct infection to your bone, but it's basically just an infection in the bone. And so it was believed that Joseph Smith got his infection after this incision was made on his abscess and it was drained. So again, remember, nobody washes their hands, so very likely. And then what happened was it went from his arm into his tibia, or circulated through his blood, and then settled in his tibia, where the bacteria started to proliferate and just kind of sat there. So here's a couple of the symptoms of osteomyelitis, just so you can get an idea of some of the other things that he was going through. So I don't think pain's actually mentioned in this. Tenderness and sensation of warmth around the infected area. Oh, pain right here. Oh, pain. Swelling around the infection area. That was another concern for the family because his leg did swell up a lot. They had to have another doctor look at that. More nausea, more fatigue. He already went through one fever. It's possible he had another fever. Of course, he was a kid, so irritability or lethargy. So not a good thing. So this can be done through a bacterial or a fungal infection. If it takes hold and it's not treated, basically what happens is you get an abscess, so like another one like in his arm, except inside of the bone. And what happens is you have cells called immune cells. They're neutrophils, but that's not, I don't need to get too specific, but basically you just have immune cells that go to the site of infection and they fight as best as they can and they die. And you get this pus formation. And what happens is that pus starts to build up and our bones don't have really good circulation with blood already. But when you have a large amount of pus start to build up in the bones, there are sections of areas where the infection is occurring that have blood supply that is cut. And if it's cut for long enough, then the bone starts to die. So they called Dr. Stone, and Dr. Stone made two incisions on his leg, not really sure where, but they did it so that it would drain, and look a little bit more normal, take the pressure off, look like this leg right here. And this helped. It helped a little bit. It got rid of some of the pain, but Dr. Stone, he was straight up and he told them, hey, like this isn't a solution. This is just a way of treating one of the symptoms. And so he sat his parents down, he sat Joseph Smith down too, and he told him that the best that he could do was amputate, cut his leg off. So there really isn't much that can be done for this disease at the time, which is why he recommended amputation. Today, if caught early, then a patient can be treated with antibiotics. It takes about 6 weeks, which is a long time, before they're good. And if the disease progresses, so like if the disease, it's a little hard to find this pointer sometimes, the disease gets far enough, then these dead pieces of bone also need to be surgically removed. So they still need to do surgery. And it can take up to 2 months on antibiotics, an IV drip, before they're good. So here are some of the tools that they used at the time for this procedure. I believe these are bone saws and the blades that they use to cut the bone. These are the tongs or pliers that they used to pull out the pieces of bone after they've made their incisions and their windows. These are the blades that they use, I believe, to cut the flesh. I think these are drill bits. I'm not really sure, but I'm sure that this is the drill that they use when they drill into the bone. I'm not sure what this is called. I think that's what you use to clean your teeth, but it's in the picture. So here's kind of a depiction of what an amputation at the time kind of looked like. So you have your gang of fellows who have to hold down the poor guy, the guy who's the patient for this amputation. And you have the doctor who is doing the actual amputation. As you can see here, they're doing a leg amputation similar to what they would have pretty much done to Joseph Smith. This is on his right leg. They would have done it to this leg. But it's not a pretty thing. It's by no means not brutal. But in the long run, it was merciful. This guy has it infected in his leg. You could get it infected in your mouth. And it's a lot more merciful than living the rest of your life, or as long as you will live, maybe the disease will take you. But you'll have a completely crippled jaw or crippled limb that you'll have to be living with. You'll be in constant pain. Amputation is the way to go, at least with the technology and methods that they had at the time. So obviously Joseph Smith's father was completely devastated, absolutely distraught. And I think it was mentioned that Joseph Smith's father was so in shock that he could do nothing but hold his face in his hands, just trying to really sink it all in of what was happening to him. And I'm sure any parents hears the news that their kid's going to be losing a limb, be having a very hard time. Just maybe let that sink in for a little bit of the emotions that his father was going through. His mother, however, was a little bit different. Now, she was a little more stubborn and refused to accept the fact that her kid might have to live with a completely debilitating disease, or not disease, procedure that would completely change his standard of living. So she decided to get in contact with with a council of doctors, which was the equivalent of getting a second opinion. So these doctors, they recommended her to a doctor called Dr. Nathan Smith. Now, who was he? Well, in short, he was the guy who performed the procedure on Joseph Smith, and he was also the only man in the United States at the time who could have ever possibly had a chance of allowing Joseph Smith to keep his leg, and potentially, probably saved his life. So Dr. Smith was often regarded as a very unusual doctor because he did not like the common practices and medicine procedures or surgical procedures that were done today. I mean, not today, in his day. And he would often criticize them and try to implement new ideas and new ways of doing things. Now, in early America, there was very little information concerning medical education. For one, becoming a doctor didn't always mean you had to have an education. Uh, the reason for this was because you didn't have to get licensed. There was no test that you needed to take to get accredited. Um, there was also, on the same train, there were no hospitals, right? The way that these people made money was they would grab their tools, they would grab their medicine, and they would saddle them on horses. They would often take their assistants with them. Or in Dr. Nathan's case, he would bring his medical students along. And they would just travel from town to town and see if anybody needed his assistance. There were also no operating rooms. Surgeries were done in the home on a bed. There was no anesthetics. So there's also no, as we know, right? And there was no concept of germs as well or bacteria, which is scary nowadays. And it wasn't until an address of antiseptic system of treatment in surgery. This was written by a guy named Dr. Joseph Lister. There. You might be familiar with the name Listerine, cleaning your mouth, an antiseptic for your mouth, the mouthwash. He didn't make it, but a different doctor, he named it after him because basically what Joseph Lister wrote in this article was the recommendation that, hey, maybe we should start washing our hands before we get up in people. And so it's kind of wild to know that, I think this was in when was this? Let me check. 1867 or 1868, around that time. So a little over 100 years, right? Where people barely have started washing their hands. So that's crazy. And before surgery, nowadays, surgeons, what they have to do is they have to stand at the scrub sink for 5 full minutes. They use an under the nail brush and a very strong soap. And they use the scrub brush on each one of their fingers. They do both sides of their hands, and they have to scrub all of the way up to their elbows. And then I think they put on like 50 gloves or something. But yeah, so I think that's pretty cool. A little bit about his backstory, right? So believe it or not, we already talked about the gruesome nature of what a amputation is and how that can traumatize anybody. But it was actually an amputation that launched his career, right? It what got him interested in medicine. So back in the day, I'll refer back to this. You needed a bunch of guys to hold down the patient that was going to be undergoing the procedure. And Dr. Nathan, or just Nathan Smith at the time, was called to be one of these people. He was 24 at the time, was a pretty strong guy, and he was called to hold him down. And so you can kind of try to imagine the thoughts that are going through these people. Look at his gaze, not even looking. This guy has his eyes closed. This guy might want to, I don't know what's wrong with him, but oh, he's looking at him. Maybe it's a sympathy look. But you can try to imagine the thoughts that are going through their heads, witnessing something like this. But you can imagine the thoughts of the actual doctor that's doing the procedure and actually cutting this man's leg off, and the collectiveness and the precision that somebody has to have to be able to do something like this. And so it takes a lot of determination just to help. It's a lot of kindness, because again, this isn't something that you just want to do because it's a solution. You do it because it's the last solution, and it's the last thing that anybody wants. He doesn't want it. He doesn't want it, and none of these guys want it. It's brutal, but merciful. And he witnessed this whole ordeal, and he was like, hey, you know what? I want to be a doctor. I want to study medicine. So he started studying medicine at 24 after seeing this operation done by Joshua Goodhue. Oh, I didn't put a slide in for Joshua Goodhue. Smith, he begged Goodhue to be his apprentice, to let him be his apprentice. But Dr. Goodhue, he didn't like and this is where Dr. Nathan got it from. He didn't like the procedures and the practices that were done in America at the time. So he told him to get an education. And so Dr. Nathan was like, okay, gotta get an education. Like, how am I gonna do that? Fortunately, Dr. Goodhue was kind enough to give him a recommendation. And so he referred him to a guy named Reverend Samuel Whiting, who he worked with and who allowed him to get experience in the medical field. And he came back, and Dr. Goodhue was more than willing to allow him to be his apprentice. And so they worked together, and he went to school. He got his degree in his bachelor's in medical science. And he was the 5th graduate of Harvard Medical School. And when he came back, he established his own practice. So he followed in the footsteps of his mentor, like we mentioned, kind of the same mentality. He changed the way that medicine was being practiced at the time. He made some arrangements, and he moved to Edinburgh. I think that was Europe. I think that's in Europe. But when he came back, he set up a new practice. He taught in medical schools such as Yale, the University of Vermont, and Dartmouth Medical College. He taught pharmacology, anatomy, physics, chemistry, medicine, taught a bunch of things. So he was a very smart man. And you might be wondering, well, how did the Smiths manage to get a doctor like this? Right. Well, at age 11, Hiram, Joseph Smith's brother, was sent to Moore's Charity School. It's not exactly Dartmouth, but it's associated with Dartmouth College. And about 2 years later, after his attendance, the typhoid fever broke out. And Hiram returned home ill, and he saw all of his siblings were sick as well. And he knew that Dr. Nathan Smith at the time was teaching at Dartmouth Medical College. And it's believed by people nowadays that it's because of that connection that Dr. Nathan Smith was able to be the doctor to perform the surgery on him. Now, it should be noted, and this is kind of one of those crazy coincidence, luckiness kind of things to happen. Dr. Smith should not have been at Dartmouth at the time. The only reason that he was there was because of the typhoid pandemic that was happening. He had a contract. He was going to go study. I mean, he was going to go teach in Connecticut, work at the medical school. But because of the typhoid fever that was going around, he decided to stay. So he felt that he would be more useful during a time like that here. And not only that, but he only lived 5 miles away from the Smiths, so it's not a long journey at all. So that's pretty cool connection to kind of just see. So what was his second opinion? Well, when he was giving his own examination, he brought his medical students with him on a cavalry, which was quoted in one of the books, to be quite a sight to see. You see a doctor with 12, 13 horses just pop out of nowhere with all of these tools, all of these people. But anyways, he said this, and it was noted down by one of his medical students, that it occurred to me that I could save young people and spare them an operation if I operated on the bone directly. Now, again, surgery, operating for osteomyelitis was not even considered. And if it was, it's probably deemed something that was not exactly possible, at least in the Americas at this time. I'm not really sure about Europe. I know that they were a little bit more advanced at the time, I believe. But that's what happened. That was kind of his eureka moment. So, Lucy Mack was very persistent, because Dr. Smith, before mentioning surgery, or rather an experimental procedure, he mentioned he didn't offer amputation because he thought it was stupid. He mentioned it in one of his lectures that if anybody offers amputation for osteomyelitis, is incompetent in medicine and knows nothing about surgery, which I thought was very funny. But yeah, she was very persistent, adamant. She didn't want her kid to lose her leg. And so what he offered was this experimental treatment. And Lucy Mack agreed to it, and Joseph Smith also agreed to it. He was 7 years old, and he was already consenting to this, life or death. I don't know if it's life or death. It might be procedure. So there are a couple of counts of the surgery that happened, but the two most notable ones occurred from Joseph Smith himself and Lucy Mack. While Lucy Mack was not present during the actual surgery, she was told to stay outside. It was believed that the procedure was actually retold by Smith Sr., who then described everything that happened to her, and then she wrote it down. And some of the notes that were taken from the medical students when compared to what she wrote was pretty much the procedure. So it's a pretty accurate representation of what was actually happening, or what they actually did to him. So here we have another gruesome picture of what was potentially going on. So this is actually an amputation, but we can imagine that this saw here just doesn't exist. Pretty much just be the same thing. Dr. Nathan Smith had about 11 medical students, I believe. There's two more doctors, Dr. Perkins and Dr. Stone, who diagnosed him before. And they basically just restrained Joseph onto the table. He did not want to be tied down. He refused to be tied down. He said that he would not undergo the procedure unless his father was sitting right next to him. So that's exactly what he did. And, they had their discussion about the liquor, the thing that we typically mention about Joseph Smith and his surgery. And this was the only type of painkiller that they had at the time. And, he said, you know what, no, I don't want it. I'm ready to tough it out and experience it completely. And so they began the surgery. They excused Mother Smith from from being present. He did not want his mother to witness him in a state that he was about to endure. And so we begin the surgery. So what was done? So as complicated and gruesome as the actual surgery was, it's pretty straightforward to kind of describe. So essentially what happened is you'd begin by drilling some holes, not exactly sure how. I didn't go that much into the research of it. And then with his drill, and then he would saw kind of a little window. He would remove that, and that would give him access to the inside of the bone, where he would use his tongs or pliers or whatever. Can't really draw them, just like pliers, to remove little pieces of bone that were broken or infected. And it was really important to take out all of the infected pieces of bone, but there was kind of a problem, right? So it's really easy to take out these big chunks that are already broken, you know, not really any problem. It's when we get to these little pieces or even big fragments, but that are connected to living tissue, when we start to get problems. So Joseph Smith actually described the procedure, and he said that he didn't really feel any pain when they were drilling or cutting on the bone itself, but it was the moment when they started pulling on live bone tissues that the pain suddenly became excruciating. There was a video that I watched that was going over this, and they described kind of a good analogy for it. You can imagine pulling a tooth, right? So you don't really feel any pain when you like touch your teeth or you hit your teeth, maybe a little bit. There was a video, or rather on the news that I saw, there were some kids that were taking a file to their teeth so that they were straight, which was stupid, but it just further develops the concept that you know, there's really no pain here. That's kind of the same with the dead bone tissue that they were taking out. But if you take pliers to the tooth and then you pull, I don't know if anybody's ever done that. I don't know if anybody's done like the doorknob thing and they tie a tooth or something. It's brief, right? But it's still very painful. But this would have been a lot more painful to a different degree, maybe. I'm not sure. But here's kind of an account. I kind of want to read through it with you. You can read it in English here, but I will have the translation in Spanish. So, the surgeons commenced operating by boring into the bones of his leg. First on the side of the bones where it was affected, then on the other side, after which they broke it off with a pair of forceps or pincers. Imagine hearing that. They thus took away large pieces of the bone. So that's the easy part, right? When they broke off the first piece, Joseph screamed out so loudly that I could not forbear running to him. On my entering the room, he cried out, "Oh, mother, go back, go back. I do not want you to come in. I will try to tough it out if you will go away." So imagine that. Imagine being Lucy Mack, or just being yourself and witnessing your kid go through something even remotely close to this. And your kid tells you to go away. It's the last thing you want to do. You want to comfort, you want to care, you want to tell them it's going to be okay. But that's not the case. So, sad. When the third piece was taken away, I burst into the room again, and oh my God, what a spectacle for a mother's eyes. The wound torn open, the blood still gushing from it, and the bed literally covered in blood. Now imagine witnessing that. Joseph was a pale corpse, imagine the fright, and large drops of sweat were rolling down his face, concern, whilst upon every feature was depicted the utmost agony. So obviously Joseph Smith was going through a hard time. His dad already was in shock at the fact that he was going to live with or see his son live with his condition. Having to sit next to him through the entire procedure, though, that's different. And then his mom not even being able to be there for him is something else as well. I was immediately forced from the room and detained until the operation was completed. But when the act was accomplished, Joseph put upon a clean bed, the room cleared for every appearance of blood, and the instruments which were used in the operation removed. I was permitted to enter again. So if we go back, we have to go back pretty far. And just seeing these, I don't know if you've ever been to the dentist and you see those drill bits and everything else, it cranks up your anxiety to 100-fold. But seeing these things and knowing exactly what's going to happen without any sort of painkiller or getting knocked out, oof, can only imagine. Now, here's one of the important things that really we would have only expected from somebody like Dr. Nathan Smith. So after they were done, completely breaking his leg, essentially, tearing pieces out and everything. So imagine this, actually. So you have a cut. I'll do this just so you know where I am. They cut it all the way down to the bone marrow, and they have his entire bone exposed from the surface down to the marrow. And they leave it open. And it's a very bad wound. It's a very complicated wound, but he tells everybody not to touch it. Joseph, don't touch it. I'm not going to touch it. None of you students touch it. Your parents do not touch this. And so we know that this is a very good call. It would have potentially led to further infection. It could have led to something that would have absolutely killed him. If it was any other physician that tried to do this, they probably would have killed him. And so by allowing his wound to be open, 14 other little pieces of bone were able to surface. He was able to take him out. And eventually he was able to, after everything had healed for the most part, it was sewn back up. And the surgery was deemed successful. So in 1816, they moved to New York. He was pretty much on crutches the entire time. He stayed on crutches for a very long time until he healed up. He started to use a cane, but he was able to keep his leg. It's amazing, right? Think about it. Think of all the things that Joseph Smith has done that would have been completely different, would have been written completely different if he didn't have his leg. All of the people that he helped, all of the ways that he helped that would have required him to have a leg. Even if he didn't have his leg and he was still called on by God to carry out his work, it would have been significantly harder. People saw him and they knew and they thought that he was a great man, powerful man, inspirational person, which he was. But if you come all this way, you see he's missing a leg, maybe we don't like to admit it, but we do judge by appearance. And knowing that he had a missing leg, he had a limp, but if he was missing a leg, people might have looked and treated him differently. So for the rest of his life, he was able to walk. He did walk with a limp, but he was able to keep his leg, and that was amazing. Now, here's the thing, though. The procedure that Dr. Nathan did, nobody else could do it. Even his own students who were there watching the surgery that was done on Joseph Smith, taking notes, writing everything down, they weren't able to replicate what he did. And a lot of that had to do because Nathan Smith was able to locate the area of infection by touch. And this is something that not a lot of people could do. And when they did it, they just couldn't find it, or the person would die shortly afterwards. And so the surgery was not adopted. They said it's too hard to do. He was the only person who could do it, so they decided it wasn't a worthwhile procedure to pursue since it was too complicated. And so you go into, and it doesn't change for a really long time. So you go into the Civil War, you go into World War I, and they're still just amputating people's legs when they get bone infections like osteomyelitis. And eventually the X-ray machine was created, and it made it a little bit easier to find where the actual infection was. But surgically, the results were very poor. And the first part of the 20th century, mortality was very high. Complications were significant, and it was very common that the person would have to undergo several surgeries before it was considered a success, which it may have not even been. But yeah, that all had to do with the fact that Dr. Smith was able to locate the area that he had to operate on, and he had something. He was guided to do exactly what he needed to do. He was able to go inside and take out everything that was bad, leave everything that was good intact, and just have his intuition and his hunch. I don't even know if it was a hunch to just not touch the infection. I mean, the open wound afterwards. So in 1864, Nathan died. He had 10 children, which is a pretty large family. I'm sure people at the time had large families, but that was still a pretty decent sized family. He was a very kind man. He was often described as working with charity a lot. You know, he knew what he had. He knew the experience and talent that he had, and he wanted to share that with people. He would often do work for free, and if not, he would, like if there was a patient and they had this operation or this medicine that cost a lot of money, he would still do it or give them the medicine, and he would just tell them to pay them back when they can. For most of his life, essentially, he lived he wasn't a rich man. He had debt, he had not a lot of money. So he was a very kind man in that regard. Obviously a very smart man, very talented man, and he was the man who was able to do this procedure that nobody else could. And so he died in, I said 1964, in 1929, there we go, January 26th. He founded Dartmouth Medical School, professor of anatomy, surgery. We went through all of that. And, nobody but Dr. Smith and the watchful and merciful hand from the Lord could have saved Joseph Smith, not just from the typhoid fever that happened, which is one attempt to take him out early, but also from the amputation and then from the infection that would have most likely also killed him. But all of these things kind of coincided. The fact that Dr. Nathan Smith was even remotely close to Joseph Smith is amazing as well. Yeah, being able to avoid that amputation that would have crippled him gave us the opportunity to reap the rewards and the benefits of his struggles in attempting to go forward in full stride to restore the gospel for everyone in the world. And so that's all I brought. I hope you guys enjoyed it. I hope it wasn't too long. I hope it was interesting, but I enjoyed researching this a lot, and I hope that you enjoyed listening to some of the things that I learned. I hope you learned something, and if not, I hope then you just had a entertaining time. But yeah, I hope that's all I got for you guys. My throat is starting to act up, but it's not typhoid. We're good. It's not COVID either. But yeah, I hope you guys have a good rest of your day. And with that, I'll end this meeting.